Welcome back, NCLEX RN preppers. We're going to go over some review and rationales from the 3rd edition, Comprehensive for NCLEX RN, written by Pearson. Includes from free NCLEX review app, which I do not have because this is a used book. Listed on the side here are some of the things: management of care, health, safety, and infection. Some of these things are in your book or your CPR report. I do apologize. After you take your NCLEX RN, you print up the CPR report. It tells you what you did not succeed on. It has topics from preparing, safety and management, health promotion, psychosocial integrity, written by Pearson. Goes up to chapter 68, study tips to prepare for the NCLEX. Also some memory aid, how to use this book. Talks about the author and preparing for your CAT exam. The CAT exam now is changed since 2023 of May. So it goes from 85 to 150 questions. What to expect on your exam day, the actual exam. And it goes into some statistics. When you need to prioritize, it's a very important task-taking strategy because many questions are written in analyzing level of difficulty. Expect to get a reasonable amount of questions, which all of the options are technically correct. You must decide what is the best situation response for the client and situation. Questions such as these require you to engage in priority setting. Universal strategies for prioritizing in nursing are outlined in sections, such as Maslow's hierarchy needs, airway, breathing, circulation, least stable or most at risk for the complication, and time and scheduling. There's words that are red flags it talks about here. You want to make sure that you do not pick options that have those words. Those words can be as often as usually, likely to, probably. They are closer examination. They could be part of your correct option, but you want to be careful that these are red flags. In an all or nothing world, the nursing practice is not all or nothing. Watch for words that include that. And you will use do not pick the options that are all, every, none, never, always, cannot, must not, and only. We're going to do another practice question. Number 5. A client takes warfarin, is given aspirin for a headache while visiting the neighbor, who is a nurse. The client subsequently has bleeding episode caused by the interactions of these drugs. The legal nurse consultant interprets which necessary elements of malpractice are missing from this case. This is a SATA question. Select all that apply. So you would look over here. Is it a breach of duty, a duty owned, injury experience, causation between nurse's action, injury, and intent to cause harm? Go over here. Number 5. Answer 2 and 5 are the correct answer, which is number 2, a duty owed, intent to cause harm or injury. With this answer, it talks about there was no nurse-client relationship because it was a neighbor. It is not the neighbor's fault. It was not an employee capacity. Thus, it cannot be duty owned. Intent is not necessary elements of malpractice because malpractice can occur when the unintended action occurs at a job. There was no breach of duty because this was no official nurse-client relationship, which accompanies an employment situation. There was injury experience because of this event. The bleeding was caused by the interaction of the aspirin and the anticoagulant. Talks about how it's a cognitive level, analyzing, client need, management of care, integrated process, nursing process evaluation, fundamentals. Eliminate intent to cause harm and injury. Since this is not necessary to charge a malpractice, next note that there's no duty owned. Good luck studying, RNs.